Atta girl.
Welcome to Aging on the Suncoast. I'm your host, Jason Martino. Like previous years, the Medicare annual enrollment period started October 15th and will end on December the 7th. This period is a critical time for Medicare beneficiaries to review and understand their Medicare coverage. To help consumers in Pasco and Pinellas Counties, the Department of Elder Affairs SHINE program provides unbiased, free, and confidential counseling to assist beneficiaries make independent decisions in order to maximize their Medicare health coverage. On today's show, we've invited back Janet Mills, the SHINE Area Coordinator, and Charles Franckle, the SHINE Local Area Coordinator. Together, these two seasoned SHINE volunteers will shed light on a valuable program that has helped beneficiaries navigate a complex system of health care coverage for over 24 years. Janet, welcome back to the show, and Charles, welcome back to the show. We're really excited that you're here, and you're here at a very, very busy time of the year, aren't you?
Yes, indeed.
Yeah. So in September, I believe, and correct me if I'm wrong, that most beneficiaries that are receiving Medicare as their health care coverage receive a book. It's the 2018 Medicare and You book, correct?
That's right.
Right. And on the back of that book, it talks about that if you need assistance, that you can call your Florida SHINE program to get that valuable assistance. And we think that that's pretty neat because that's one way to highlight the fact of how important SHINE is throughout the state of Florida and SHIP programs across the nation. So let's go into what SHINE is a little bit, and I'm gonna use myself as an example to kind of set a scenario. Excuse me. So let's say that I'm on the cusp of eligibility to become a Medicare beneficiary, and I probably have a flood of different thoughts going through my head, and maybe I don't know where to turn. So what am I to do if I'm new to Medicare and I need to start to enroll myself into it?
Okay, well, first of all, you may need to enroll, and someone may not tell you that you need to, but if you're 65, then you're eligible for Medicare. Mm-hmm. If you've already got Social Security, then it's going to be automatic. You'll get a card 3 months before your birthday, and it'll say you're eligible, and here's your card. But if you are not, and you're turning 65, then you need to contact Social Security. You can do it by phone, you can go in, you can do it online, either at the Social Security website or you can go to the Medicare.gov website and it will do it through Social Security. So that's the first thing. Mm-hmm. And some people will want to take B because you usually have to pay for that, and some people won't. And the major thing there is whether or not you're working and have employer insurance, okay, in which case you may not. And we can help you through that decision. Then once you're enrolled, you have the decision, how am I going to take my Medicare? Mm. And this is where it becomes a little more complex. Yeah. There are many choices, and we can help you work your way through what may be best for you. We can tell you what the options are. You're the one who makes the decision. Well,
I appreciate that, and I would probably appreciate a whole bunch of help during that time because it does sound pretty complex, and it does sound like it would be hard to navigate. So let's just say that I'm enrolled in Medicare now. I made my choice. Now we get to a period where I need to start to make some decisions because we're now into an annual enrollment period and what we call locally AEP. We shorten it up a little bit just because we talk about it so much, but it's the annual enrollment period. What does that mean to me as a person that's enrolled in Medicare? Jen?
You get to make plan choices during this time between October 15th and December 7th for effective January 1st. Mm-hmm. So whatever you had last year, you can continue on. You should have gotten your 2018 plan information that you're currently in by now, but you can call SHINE and we will discuss other options with you, whether you want to have a Medicare Advantage plan or whether you want to have original Medicare and maybe a Medigap supplement policy and then a standalone Part D. Those are the two main ways to express your Medicare. But call us and we will help you.
Well, thank you, and I will, because and it sounds like if I heard you correctly, that while I may have enrolled in Medicare, let's just say June, that time frame for the annual enrollment period is really the only time I get to take an investment into my health care coverage and take a look at if it's really meeting my needs or not. Is that correct?
That is correct. Okay. But there are some programs that might help you where you could change more often, but I believe we're going to discuss those a bit later.
Okay, good. Yeah, we'll talk about that a little bit more comprehensively. So, and what's the time frame of annual enrollment? I don't think we could probably say it too much today because it's so important.
October 15th through December 7th for effective January 1st of 2018.
So, Charles, I've worked with you for a number of years, and I appreciate the seasonedness that you bring to the table on there. Why do people really need to invest in the time to take a look at their current coverage?
There's several reasons. One of them is that the plans change year to year. So even though you're satisfied with your plan this year, you may, and they're going to send you, these are the changes for next year, people don't always look at that closely, especially when it comes to the drug part of it. And the changes may be substantial. So you should always see if there's a better plan. Also, in many of the Advantage plans, their networks change frequently, and you need to verify that the plan you have, your doctors and other providers still take that plan. If not, you better be prepared to change providers or look for a plan that will take your providers. So this is a process that should be reviewed every year, but you know, people went through it that first time and it was not easy, so they're kind of reluctant. Do I have to do this again? Well, you learned something the first time, and we can help steer you through the second time, too.
Yeah. You know, my grandma just recently passed away this year here. And prior to that, and I love my grandma to death, but for 3 to 4 years, maybe even 8 years before her death, I would have conversations with her, and I would talk to her about the importance of taking a look at that plan. Her plans, and weighing out the options of what she had on there. And she lived in a different state, the state of Washington. And their SHIP program is called Shiva or Shiva, I forget what it is over there. And her common response, and I'm building off of what Charles was talking about, was, honey, they take such good care of me, and I feel like I'm really comfortable with them. And I would say, Grandma, I said, I respect that, but, you know, you can take a look at, you know, what your formulary is, and if there's ways that you can maximize your money. And she wasn't higher income at all. So I think that's what I heard you say, Charles, is very reminiscent of what I think I've dealt with personally with my grandma, and most likely I'll be doing the same thing with my parents, my mom and my dad. Yeah. So the donut hole, Janet. We hear about the donut hole a lot. I understand it as that gap. Can you explain it a little bit more and maybe articulate to us of why it's important to review our plans to either avoid or to try to minimize the size of that hole?
Right. Every year there is a maximum out-of-pocket that a person is dealing with in a Part D. And the donut hole is prior to that, and then so the prices go up. So if, like Charles was saying, you can review your plan to make sure that all of your drugs are covered under the plan, because all of the plans have different formularies, meaning drugs that are covered and different tier costs, etc. So you need to look at that Part D picture. But they're also, by calling Shine, we can communicate information with a lot of different prescription assistance programs and send you information on how you can apply to perhaps get those drugs free of charge. So that is very helpful too.
Yeah, it sounds like it's helpful. Anything to add?
That's why I say, yeah, during the review period, when we're comparing plans, whether it's an Advantage plan with drugs or a standalone drug plan, one of the things that we see is come June, or maybe it's September, or it could be February, you're going to hit the donut hole. So we can start planning for it now and not be surprised. Yeah. But I will say one other thing about, you know, the people who don't look at their plans ahead of time, and come January they go to the doctor and find they're not there, or they find the copay has increased substantially, or they find their drugs are no longer on the formulary or something like that. There is a period, kind of the remorse period, up until February 14th, when you can drop that plan and go back to original Medicare. But that's your only remedy at that time.
Is that right? Yeah, that'd be quite a shocker if you thought your traditional system was in place and then you just didn't have that option during that time. That can be very scary for a lot of different people.
It is.
So because I work very closely with you all, and I know that you are mentors and you train and you help coordinate a core of 60 different volunteers through the Area Agency on Aging covering Pasco and Pinellas County. I know that this is the busiest time of the year for you all. And I'm still kind of in the annual enrollment period time frame. and you've given a good description of what you can do in the premise of AEP, I'll just call it for now. What other kind of things can volunteers do during the AEP time frame? What kind of roles do they play?
There are lots of other issues that SHINE deals with, and you might have a bill that is incorrect or is not being paid. We do not have money to pay bills in the program, but we can help you with the issues. We have other employer insurance interacting with whatever this insurance that you have. We can't really deal directly with Social Security, but we know about Social Security issues and we can direct you there. We can help you to apply for government programs to reduce your Medicare costs. We also know about Medicaid programs that are available and can direct you and help you there. There are lots of other factions, just other than plan choices, that SHINE deals with.
What an asset you guys are.
And we have a lot of outreach sites, and we have a lot of outreach presentations, which are educational to learn the process as well.
Cool, cool. And then we're gonna talk about SHINE too. Anything you'd like to close with, when, in particular, when we're talking about annual enrollment period? Anything that you really want to make sure people understand as they watch this show?
Yes, I think one thing that's really helpful is if you're calling the helpline, the area agency helpline, if you call them and you tell them what is a known time that you're usually always home at the telephone number that you give, that is so helpful to us.
Okay.
Because we are in at 2 to 3 day, we try to keep it to a 2 to 3 day callback time, but being able to reach people is really key.
Yeah.
We do try more than once, but even so, that would be very helpful. And don't wait until the last minute, so do it now.
Yeah, because it's going to affect the rest of the year for them, isn't it?
It will.
Yeah, so that's a great closing piece for the annual enrollment period. So let's talk a little bit broadly about SHINE, if you don't mind. What is SHINE? Do you care?
Well, I'll start. SHINE is a ship. Okay, and people don't understand the SHINE. I know it's a Florida program, yes, but it's Florida's ship. And those are state health insurance plan assistance. And they're funded by Medicare to help people with all the things that Janet has discussed. And we are all volunteers helping you. So sometimes that's why maybe we can't get back to you every day. You know, it's not a full-time job.
But it is full,
except for Janet.
But by the frequency that you work, it's a full-time job. That's for sure.
It does seem that way at times, yes. Yeah. But mainly we offer free, unbiased help and information, mainly to help people make their own decisions. We can't tell you what's best for you. We don't know. You know, so it's going to be your decision. But we can help clarify your options and do many of the other things that Janet was talking about.
And these SHIP programs are in each and every state of the United States of America. But for Florida, if I heard you correctly, that in Florida they call it, instead of call it SHIP, they call it SHINE. And I think when I was alluding to what my grandma was thinking about earlier, you know, in the state of Washington, they call it something different over there. But in Florida, it is definitely called the SHINE program. And you're serving, what kind of individuals are you really talking to on a daily basis?
We're talking to all kinds of individuals with all areas of abilities and knowledge and different issues. It's a free, unbiased program, and that follows the Department of Elder Affairs mission that we work under to empower people to make their best health care decisions.
That's really important.
So we'll talk to caretakers. There are people on Medicare under 65 or on disability or end-stage renal disease. Sometimes neighbors call us. They're worried about things, but we can't share private information with them, but we can certainly guide them and give them a lot of help. So anybody who is interested in help with Medicare, we can.
And kind of quickly before we wrap up the first half of the show, the types of counseling that you work with consumers, is that face-to-face? Is it in the community?
We have many outreach sites throughout Pinellas and Pasco County, and you can either call the Area Agency on Aging to find out how to contact them, or you can go to the floridashine.org website, and on the first page it will show you on the top the counseling sites. and with the contact information as to how to make an appointment. The outreach sites work by appointment.
Okay, thank you, Jen. Yeah.
But most of what we do is over the phone, so when you call in, usually we can handle things on the phone.
How convenient, huh?
Yeah.
Yeah.
But there are times where it's not possible, and we can arrange this face-to-face.
Yeah, we're going to take a quick break, and hopefully you'll stay for the second half of the show. Please stay with us while we take a short break. As usual, don't forget to have a pen or pencil ready. During the break and at the end of our show, we'll be running contact information for the Aging and Disability Resource Center helpline, as well as the State of Florida SHINE website.
Sarah is 64 and loves to garden, but recently her health insurance ran out, leaving her worried about more than just weeds. With pre-existing health conditions, Sarah's chances of finding good coverage were low. So she called the Elder Helpline and spoke with a SHINE volunteer counselor. The Department of Elder Affairs SHINE program provides free, unbiased counseling on health insurance for those on Medicare. More information is available about SHINE or how you can volunteer at 1-800-963-5337.
Welcome back to Aging on the Suncoast. During the first half of the show, Janet Mills and Charles Franckle helped us understand how the SHINE program can help Medicare beneficiaries make critical decisions unbiasedly and for free. So let's continue this important discussion and look at additional resources that can put money back into your pocket. Janet, Charles, welcome back to the second half of our show today. We covered a whole bunch during the first half. We talked a little bit about SHINE, and we talked a little bit about what a new beneficiary should be thinking about. We talked about what current beneficiaries should be thinking about, and then we really highlighted the importance of taking very seriously the annual enrollment period, which again is October 15th through December the 7th, for them to make some pretty critical decisions based upon their health care. And similar to my opening to the show, we're going to talk a little bit more about the what we call the MIPA program, the Medicare Improvements for Patients and Providers Act of 2008, which is really the Area Agency on Aging's desire to help people with two different programs, the Low Income Subsidy Program and the Medicare Savings Program. So let's talk a little bit about LIS. Charles, what is LIS, or the Low Income?
Low Income Subsidy, also known as Extra Help, it's really a great program. It's a Social Security program that helps reduce the cost of medications for people. And it works in conjunction with your Medicare drug plan, whether you have an Advantage plan or a standalone drug plan. And what it will do is it will reduce, if you have to pay for your plan, it will perhaps pay all or some of that premium. It will reduce or eliminate any deductibles you may have. It will eliminate the gap or donut hole that Janet was explaining earlier. And just, it not only lowers cost for people in this situation, many times it just enables them to get their drugs. They just couldn't afford them. And this is something that, the income limit is around $1,500 for an individual, $2,000 for, I believe, a couple. There are asset limits as well. But if you are anywhere close, you might want us to help apply or do it yourself, because there are things which count and don't count and so forth. So, that's not a hard and fast number. But we can help you do it online at Social Security. And if you're on the phone or there with us in person, we can actually do an online application. This takes 10 minutes, maybe 15 if we're slow. And you get a response fairly quickly. And if not, you can do it yourself, or it's easy for us to help you do it. The other advantage of that, we talked about annual enrollment is the only time you can change plans. Well, they figure if you are getting help with your drugs and suddenly you take a drug that's not on your drug plan, it's not going to help you. So this program also allows you to change plans during the year, and that could be a tremendous benefit to people.
Yeah, that could be a big benefit. It sounds like a pretty neat program. And it's helpful for people to understand the eligibility factors in there, and you gave them a thereabout when it comes to household income, either on a single level or on a double level too. But I think what we also try to be careful with is a lot of times when programs put out eligibility guidelines, people tend to screen themselves and they go, oh, I don't automatically qualify that. Let us help you with that piece of it too. We can help determine if you are going to be eligible or not. Let's talk about expectations of that, because a lot of times I think an unintended consequence of us giving people some expectations is that they think that things are going to happen right then and there. So we help those folks with the applications, but who makes the determination on the eligibility of that
Well,
program?
in this case, it is Social Security, and if you do it online, it's a pretty rapid turnaround. I'd say 2 weeks has been kind of our
Is it 2
experience.
weeks?
You'll get a letter telling them what your award is, or reward, or not. You know, it can start acting immediately at that point, or even before in some cases.
It's a really great program, and we hope people call and they get help with that too. So we talked about another one that was called the what we call MSP, but it's really the Medicare Savings Program. Janet, do you want to elaborate a little bit on that?
This is a program that we help with, which is applied for to Department of Children and Families. But we also can help you do this in the office. We can't do it online unless we have you in the office with us. But we fill it out, we mail it to you completed for your signature, and a pre-addressed envelope to mail it for processing. And in about 4 weeks, you get a letter of determination from Department of Children and Families. And I just want to emphasize that with either program, nothing is held against you if it's determined that you're not eligible. But if you don't, it's the old story, nothing ventured, nothing gained.
Right.
So we encourage people, if they're close to the income and asset limits, to apply. The asset limit is about, for a single person, is about $7,400, excluding your home, your car, and some personal possessions. And the income level is $1,377 to have the state pay your Medicare Part B. That application will help you with that, which can be a tremendous savings. If you're at the the lowest income level, then you may get other benefits along with it. So we really encourage people to apply, and all it takes is a phone call, and we can help you.
What a great encouragement to do it. And I've seen you guys were able to handle both these types of applications on behalf of that consumer or with that consumer within the same day. So we're talking 15 to 20 to maybe 30 minutes worth of time just to find out if they can have a great savings throughout the year. Tremendous. Same thing for expectations on eligibility. Obviously, the Area Agency on Aging doesn't determine that eligibility, but same turnaround for the Department of Children and Families?
About 4 weeks
About
for
4
that
weeks?
program.
Yeah, a little long, which is why Jan didn't mention, but if you are accepted for an MSP, you automatically get the extra help.
Oh,
Yes.
But we will usually apply for both at the same time so that you can get that LIS. It's a little quicker process, so you can have it in place. Or you may not qualify for the other program.
Right.
So you've got it.
yeah. But please just try at least
Do
to see
try.
what
Do
you
try.
qualify
As
for.
Janice said, nothing to lose.
Right.
So let's talk a little bit about the SHINE program again. We talked pretty comprehensively about what SHINE can bring to the table for folks, and I would be remiss if we didn't talk about the people that are actually making it happen, the boots on the ground that are actually working with the SHINE program to serve these people throughout the 2 counties and throughout the state. So I do know that last year, and I'm talking about calendar year 2016, that the SHINE program served 22,400 individuals. 22,400 individuals. That's a lot of people to serve with navigation and for assistance with their health care coverage on there. These are all volunteers, as you know. You're working with them every day, around 60 of them too. So if I wanted to ever be a volunteer for the SHINE program, what can I expect from the program? Charles, do you want to start?
Oh, yeah. Well, Jan will touch a little. There is training, but you are going to have, it takes a little more dedication than some other programs.
Yeah.
So what you need is a desire to learn and to help people, some skills that Janet will talk about. But you can expect a very rewarding experience. You can expect one where you will continually be challenged and learn yourself. Just the help that we described when you provide that. I mean, that's just a tremendous function. And people, we have all sorts of different skills are useful. There is not one particular thing I say you need to have to do this.
Yeah, so let's talk about skills a little bit too. What type of qualifications should a potential volunteer bring to the table? What is the SHINE program really looking for?
Well, you do need to have basic computer skills because your first step, if you're thinking of becoming a volunteer, is to go to floridashine.org, and there is an application there. And that gets sent to our office, and then there is an orientation, an in-person orientation day. Then there are online modules that you do at home, and then Charles is our trainer that does the 9th module, where everybody comes together for a day and talks about all the questions they might have, which actually could take days, if not weeks, but that's the way the program works. So like he emphasized, if you are excited to be a continuing learner, we learn new things every day, and if you really like helping people and have a lot of patience, this is a wonderful program for you.
Yeah, that's and you just kind of move right into some of my question about the benefits from it. There's a lot, I think, that a volunteer is going to get back from paying it forward on there as well. Do they go out there and just do it all by themselves, or a team approach to things, to counseling?
Well, after the formal training, there is a mentoring process where you're paired up with a senior counselor for a period of time until you feel a little more comfortable. And you'll always have someone you can turn to with questions. But frequently you might be doing alone on the phone, or you may be in a counseling site by yourself doing this, but there are always resources. And you know, we encourage people to get back. I'll get back to you. I need to look something up. I need to consult with something else. We'll get you the answer.
Yeah, and it behooves them to take that time and do their diligence. I've known you for a great amount of time, and I've talked about different things. But tell our audience, what do you get out of the SHINE program as a volunteer? Janet, you want to start?
I think my personal reward is every day I go home feeling reward of having helped somebody, having helped many people usually. But I also love the problem solving that's involved in the process. That is very interesting to me. But that, because Charles and I have been involved in the program for a number of years, so that comes with, we get excited about new kinds of problems. Yeah. And it's very rewarding, it really is.
Good. Charles, anything to add on it?
Well, the only other thing, I mean, certainly all the things Janet talked about, but I'd mention 2 other things. As a trainer, I get, you know, to educate the new people, and I enjoy doing that part of it. Plus, you get to meet the other SHINE volunteers, you know, so you get to meet some really interesting new people.
What an amazing core of people. Janet, thank you for coming back on our show. We always welcome you every year. Charles, the same to you. You come in here and you provide a wealth of good information, and we really hope that our listeners and the people that are watching on our show take your advice and call the program to benefit from a lot of different things. We hope to see you next year. We hope you enjoyed this month's broadcast. We also hope this episode sparked your interest to contact the SHINE program in order to seek help during the annual enrollment period. Please remember, this critical period ends December the 7th, so start the process now. We'll see you next month, and until then, please make every attempt to maximize these free and exceptional resources.
Soon it will be time to make important decisions about your Medicare prescription drug coverage. The Florida Department of Elder Affairs SHINE program can provide free, unbiased guidance in selecting a Medicare Part D or Medicare Advantage plan. If you have questions or need help, SHINE can guide you through the enrollment period ending December 31st. More information is available about SHINE at 1-800-96-ELDER. That's 1-800-963-5337, or on the web at floridashine.org.